My name is Tony Booty. I'm an orthopedic surgeon with Marshall Orthopedics. We treat ailments involving the bones, muscles, and joints throughout the body. We have 5 doctors in our practice, and we can treat almost any injury that occurs. We see patients who have sports injuries, who have wear and tear injuries, who have fractures. Basically, when we talk about replacing a joint, we are resurfacing that joint. So we take away the diseased bone and cartilage, and we replace that with usually metal and plastic. Patients who need that operation have arthritis, which is a wearing out of that joint. Those patients can be as young as late 40s sometimes and can be as old as in the 90s in rare cases. Basically, we see changes of arthritis on their x-rays or MRI, and when they have too much pain to participate in the activities that they would otherwise enjoy, then we talk to them about replacing those joints.
I'm 61 years old. I was born and raised in Boston, Massachusetts, a little town south of Boston. I came to California when I was 28, so in 1980. I've been a pharmacist now for 39 years, hoping to retire in another year and enjoy these 2 new hips that I have now. So what precipitated this whole deal was me falling off the ladder. That's what started this whole deal to the hip replacements, but that's not what caused the damage to my joints. Probably at the age of 18 or 19, I got into weight training and bodybuilding. So I spent the next 20 plus years of my life just going heavier and heavier and heavier until I damaged every major joint of my body. It started with my shoulder, which I had a total replacement when I was 40 years old, so it's been 21 years when I had my right shoulder replaced. I never realized my hips were as bad as they were until I did fall off the ladder, and then that was due to heavy squats. So over the period of 20 years, I just wore the cartilage out in all my major joints, and right now they're putting me all back together, and it's just something that I did to myself, and I can't blame anyone else. Can't blame work, can't blame accidents, can't blame anything but myself. So I did it to myself, but thankfully they have the technology and the knowledge now to fix that.
I talked to Wayne for probably 4 or 5 visits before we decided to go ahead with hip replacement. We tried giving him cortisone injections into the joint to try and control the pain that way. He did some exercise to try and strengthen the area to see if we could decrease his pain that way. And we tried oral medications as well. Those modalities weren't really helping him, and so then we made the decision to go ahead with hip replacement.
You have basic 2 choices, live with the pain or correct the problem. So, I liked him. I liked him as a person and as a doctor, and as I continued to see him, we had a good rapport, and decided that he was the one that was going to do the surgery, and couldn't be happier with it. Turned out better than I ever thought it would be.
I tell my patients that it takes them about a year to completely recover from a hip replacement, but most of that recovery happens in the first 4 to 6 weeks. Our patients are getting younger and younger all the time, and so we need technologies that will last them for as long as we can. We anticipate 20 to 30 years from a good hip replacement nowadays.
You have the same technology, the same equipment, you have the facilities, you've got the doctors who have the same knowledge, and I couldn't be happier. So much more convenient. You're in, you're out, small town hospital, and it's, I don't see why you would go anywhere else.
If you are experiencing pain in your joints and want to explore treatment options, call Marshall Orthopedics at 530-344-2070 or visit marshallmedical.org.